piriformis pain and sciatica the same thing? What is the difference between the two?
And so the piriformis has become a popular muscle because of its relationship to the sciatic nerve. As the sciatic nerve leaves the sciatic notch, it crosses under the piriformis muscle, but in maybe 15 to 20% of the population, the nerve actually bifurcates the muscle. So when the muscle gets a little tight, rather than having muscle pain, you can end up with nerve pain oftentimes.
And how do I address that? What is the best thing I can do?
And so, well, with sciatic nerve, there can be a lot of other issues beside piriformis. But in terms of addressing the sciatic nerve's relationship with the piriformis, is the Vibroller Hex Pro F actually provides a very nice tool to be able to get into the muscle and then also to get into the back of the hip joint and open up space where that nerve comes through. Whereas there's three other hip rotator muscles down there that are all equally important with this nerve, but piriformis is the one that has all the clout because it has the syndrome.
And where is the piriformis?
So,
I mean, if I'm just going to stand up here.
So piriformis comes off the inferior lateral angle of the sacrum and then comes across to the greater trochanter of the hip. So it sits right about there is the piriformis muscle.
And oh yeah, I can have
It's the nerve.
Tenderness there, and I can address that with the roller.
Absolutely.
So take it on to level 2.
Yeah. So with the roller, what you want to do is take it on to a level that you feel comfortable with. Here, David, is that starting off with a level 2 would be pretty good, and then what you really want to do is take that roller and right where I was showing you off the edge of the sacrum, so right in between the lower part of the sacrum and then the trochanter, the leg bone of the femur, and then that's where you'll find piriformis. And then once you get into that muscle, is that piriformis is a hip rotator. So what you want to do is use rotation of the leg, so inward and outward in a comfortable range as the first form of treatment. Now, if it doesn't like that, you can actually use direct rolling, whereas you'd be rolling on and off of that muscle. Or what you could use is a floss of the sciatic nerve. And to do this, you would engage your ankle upward and then straighten your knee. And so it's really good with releasing muscles that if something isn't working, try the next thing. In my practice, I generally give a muscle about 8 to 10 seconds to respond. If it doesn't, it's time to move on to the next thing.
Yeah, I can definitely feel that. It's way less tender. It's way more relaxed.
Good. Starting to loosen up already.
For sure. Thank
Excellent.
you.